Hi everyone. So today I will be discussing about rupees 5 lakh free treatment. So what is the truth behind Ayushman Bharat Pradhan Mantri Jan Arogya Yojana? Now I want you to imagine this. A daily wage worker in India suddenly needs a surgery costing rupees 2 lakh, and he is daily wages worker, so he have no savings, no insurance, nothing. So what is going to happen next? Debt, he's going to sell their assets, or he will be betting till his last breath. These are the situations which usually Indian people are facing, who is in lower strata. Now government says, don't worry, we will cover up to rupees 5 lakh. Now it sounds magic, right? But reality is something different. So what is Pradhan Mantri Jan Arogya Yojana? So as I have discussed in previous video, Pradhan Mantri Jan Arogya Yojana is a part of the larger Ayushman Bharat program. It was launched in 2018 under Ayushman Bharat. Under Ayushman Bharat, there were two programs. So first, improving the facilities in PSC Primary Health Center, and government changed their name as Arogya Mandir. So they just renamed and increased some facilities for primary interaction of health. So I was discussing that uh, government has renamed PSC as Arogya Mandir, and health and wellness center earlier they called, and now uh, perhaps in 2023 they renamed as Arogya Mandir. So for the primary interaction of public with healthcare, uh, Arogya Mandir will be there. But what if you need secondary and tertiary healthcare? So for that, because there is a lack of human resource, there is a lack of hospitals in India under primary and tertiary healthcare. And also, if you are visiting secondary and tertiary healthcare, then you need too much resources. But 40% of Indians are lacking for this. So what they will be doing? So government said that, wait, I am launching government funded health insurance scheme, and it will provide rupees 5 lakh per family per year. It will be This will be cashless treatment at impaneled hospitals. What was the target? It was targeting poor and vulnerable families in India, basically who is belonging to BPL, below the poverty line family. So what happens? Government becomes your insurance company. Now let's imagine through a story. Suppose you met Ramesh, who works as a construction labor, lives in a small village, and his monthly income is rupees 10,000. One day, he faces he started suffering from chest pain. He visited hospital, and what results that he needs surgery immediately. The cost of surgery is more than 3 lakh, 4 lakh. So what do you think? He will be going for the surgery, or he will wait to die? So now here the PM-JAY comes into picture. Because Ramesh has a PM-JAY card, he goes to an impaneled hospital, gets treated, pays rupees 0, yes 0, and get got well soon, got well. So now let's break how it works. First one is What is the eligibility? So eligibility is families who is belonging to below the poverty line families according to uh, section 2011 uh, data, population data. Basically it targets poor households. They have to apply for Ayushman card and beneficiary get Ayushman card. Government have tagged some with some private hospitals and their own tertiary and secondary care hospitals. What is the facilities? Government provides cashless treatment. Under cashless treatment, first government will verify your eligibility, then they will approve your treatment, and government pays directly to the hospital. Now it looks simple on paper, but there is a lots of confusion involved in all these things, and there is lots of crisis and corruption are involved in all this process. So now I want to discuss what does it cover. PMJY covers hospitalization expenses, surgeries, medicines, diagnostics, but no OPD. Basically if you will visit for general health issues, you are not going to get the benefit of Ayushman card, and it has limited preventive care diseases in listed in it. So basically what is happening, it pays when you are already sick, not to keep you healthy. It is not for preventing you from disease. It will help you only when you will get disease. Now let's talk about some issues with this. First one is awareness gap. People who are not literate, or who are staying in villages, or who are staying in uh, remote areas of India, they are basically not aware about this scheme, that what is Ayushman card, how we should use this, how we can get the benefit from this. So I think many eligible people don't even know that they are covered. So rupees 5 lakh insurance is unused for in large section of or in remote areas. Now there is a story of impaneled hospital. Sometimes impaneled hospital refuse to treat PMJY patients. They prefer cash paying patients because PMJY rate is lower, and they uh, they will earn lower profits. That's why they refuse to treat the patients. So what is happening? Government has decided that they will pay this much cost only under PMJY to the hospitals. But there is no regulation of cost of treatment in Indian hospitals, and because of that there is a different charges for same treatment in different hospitals in same localities. And because of this irregularities, they are benefiting, and they refuse to treat basically uh, patients. Sometimes uh, there is a fraud and abuse issue also, like they will create fake patients, unnecessary procedures, they will write unnecessary prescriptions, unnecessary checkups, and they will just increase the money because they know patients are not going to pay, government will be paying. So they do some inflate they do something to inflate the bill and charges more, so that they can earn on corrupt more money. So these are the stories, these are the pro issues with the PMJY. Now what do you think? Rupees 5 lakh sounds big, but do, imagine that someone is suffering from cancer, someone is suffering from brain disease, someone suffering from spine disease. I think rupees 5 lakh is not enough for all that treatment. So the cost of cancer, the cost of treatment of cancer can easily exceed rupees 5 lakh. So there is a problem with 5 lakh also, but despite many issues, there is some real impact. Crores of hospital admissions are covered, reduced out of pocket expenditures of some people, increased access to private hospitals, and for many families, PMJY means difference between treatment and no treatment. But the question remains same, that is PMJY solving healthcare or just paying hospital bills? Because India still spends low on public healthcare, primary care is big, prevention is ignored. So PMJY is like paying for fire brigade but not preventing the fire. So I want to conclude this video that PMJY is lifeline for the poor, yes, but it is not perfect. I think it's a powerful safety net, but not a complete healthcare solutions. So next time when you hear rupees 5 lakh free treatment, remember it's real, it's helpful, but it's not going to save you completely. Thank you.